From the nation's capital in Washington, D.C., Cole on Congress. The program discussing national issues that affect Oklahoma. Your host, U.S. Representative Tom Cole.
Thank you for joining me again today for another episode of Cole on Congress. Our guest today is Congressman Dave Camp, who represents the 4th District of Michigan. Dave's the ranking Republican member, the top Republican member on the Ways and Means Committee and the Committee on Joint Taxation. Today we're going to try and cover a lot of ground because Dave Camp is in the middle of almost every important debate in Congress. But I always like to start with something a little personal. And I have to tell our audience, I had the privilege of meeting Dave when he was a freshman congressman in 1991. I was much younger anyway, executive director at the National Republican Congressional Committee. I worked for my good friend Guy Vanderjagt. He was one of your mentors, and I've watched your career from the very beginning. He would be so proud of you. He really would.
Well, we've known each other a long time, and he was a tremendous leader, and I know we both feel fortunate to have known him, but he really did take people under his wing. He sort of helped guide them along, and certainly your career has done very well as well. But as we were talking earlier, he really did create the modern political committees that we see today, and I think the voter outreach that he was able to do really is one of the reasons why we took the majority in 1994, and I think one of the reasons why we'll take the majority again.
No question. And, you know, like you, served on Ways and Means. So very distinguished legislator as well as a political operator.
He was all over the tax issues and actually really understood that small business really drives employment and job creation in America, and was so articulate about that. And I know we both miss him a lot.
You bet. Well, let's start with the issue du jour, because we're going to try and cover everything from health care, which is clearly the preeminent public debate going on in the country today, to cap and trade, to tax policy and the economy. And you really are the lead voice of the Republican Party in the House of Representatives on all these things. So give us just off the top where you think we're at currently in the debate on health care. What's the president laid out? What are the struggles perhaps that they're having in assembling a coalition? And what do you see the prospects for a bill?
Well, clearly they've got 5 different bills they're dealing with in the Congress, and we don't really know. We haven't seen any of these bills since several months ago, so who knows what they're actually doing behind closed doors and what we'll actually end up facing when they do come out with a bill. But when you look at what they passed in the House, and we finally were able to get it reviewed by Health and Human Services, by CMS, which is the agency that does healthcare policy, and we had the same actuary who reviewed our Medicare Part D, or prescription drug plan, several years ago, and they're finding that this doesn't bend the cost curve. This doesn't actually, in fact, well, it does bend it, but the wrong way. Actually, healthcare costs go up rather than go down because of this bill. And we're seeing a number of other real concerns. Clearly the amount of taxes that are in the bill, $59 billion in taxes on people who don't have insurance at all. I think real concerns with the direction that, in an overall sense, that this may go. And I think really a part of this, the creation of all of these boards and commissions that will end up overseeing this bill, I think cause a real problem. The other thing is when you look at their coverage numbers, were they able to cover more Americans with health care? More than half of those are people that got into Medicaid because they raised the eligibility of Medicaid. Well, that isn't health reform. That's entitlement expansion. And so we're finally getting some of this analysis and review of their bill that really sets out the concerns that many Americans have with it. And I think they're looking very hard at trying to get support for this government option in health care. They don't have that yet. And so they're nuancing that and trying to figure out a way to get that in the bill. But everything that we know says that if you do that, we're going to have tens of millions of people lose the private coverage they have and migrate into this so-called government option or competitive option or whatever they want to call it. And that is, I think, the real concern. So this promise that if you like what you have, you can keep it, I feel is going to be broken under the proposal.
Well, and migrate's a nice word because, frankly, most people won't be a matter of choice. They'll literally, their companies, I think, will drop insurance, pay a fee to the government, and you're moving over into a different system whether you wanted to or not.
Yes, and so their goals of bringing costs down, they don't. Costs go up. They don't insure more people because of reforming health care. They end up insuring people, the majority, because of entitlement expansion. And you end up seeing significant taxes also millions of people who would rather pay the fine than pay for the high health care costs, because the plan that they're going to design is going to be too expensive for average working men and women to afford.
Well, in addition to this government-run public option, the things that I heard the most in my town meetings in August and since then in September, and they were like everybody else's. I've never seen anything like them in my political life. I mean, hundreds of people coming with great questions. I mean, they were really well informed. They were not inappropriate. It actually made me excited to see so many people concerned and caring about what the country was doing. But in addition to the public option, we heard a lot of discussion about cuts in Medicare. What would that entail for people that were already in that system? And a lot of discussion about, again, how you're ultimately going to finance this thing for the portion that is taxes. What's your take on those two areas right now?
Well, they have almost $500 billion in cuts to Medicare, which that's going to impact seniors dramatically, and that's why if you look at who's supporting this, they have a lot of softness among seniors for that exact reason. I think that's a real problem for them. They also, in the Senate bill, tax medical equipment, which is those are the things that people use to make their lives easier to live and to live longer. Things like hearing aids, like heart valves, and their tax structure in that bill is going to tax all of that medical equipment, surgical equipment, in order to raise money to pay for this bill. So what I think is a huge mistake is the fact that they've done this one gigantic bill, and that they expand entitlements to the point where they have to cut Medicare. They also cut a program dramatically called Medicare Advantage, which 11 million seniors have. And in rural areas, low-income seniors...
Huge in my district.
It's huge. 90% of seniors have some sort of supplemental coverage because Medicare doesn't meet all their needs. Well, Medicare Advantage is that supplemental coverage for people in low-income and rural areas. That I think is really one of the most dramatic things. We've seen that program expand, and they're cutting Medicare in a significant way. I think it's an unnecessary reduction as well. It doesn't need to happen that way. As you know, Republicans have a different approach, and one that we think should really be a more step-by-step, gradual approach. Let's take those things that we can do, implement them now, not tax people now and implement them in 3 years, but implement those changes now and adjust as we go along and continue to work toward, obviously, making health care more affordable, getting the costs out of health care. Their bill doesn't do that. We think our proposals would.
We've heard two different versions of how the revenue portion of this thing is going to operate. Either a tax on so-called high-end health care plans, gold-plated plans, and or some sort of additional surtax on high-income earners, many of whom, of course, are small business people. Particularly if you happen to be in a sub-S corporation, this is a really bad deal for you. Which way do you think they're headed right now?
It's hard to know, because this is all going on behind closed doors, and this is after the president said, I want these proceedings televised. I want any negotiations on health reform to be on TV so people can see who's advocating what. Well, first of all, it's Democrat only. No Republicans are in these closed-door meetings, and nobody can really report on what issues they're putting on the table and what issues they're taking off the table. I think both of those are bad ideas. Clearly, if we're going to recover economically, and in my home state, the unemployment rate's 15.3% statewide. So the economy is really number one in people's minds, and I wish we'd see this administration focus on real economic issues and try to find a way to create more jobs. So many of us are asking, where are the jobs? But if you tax those people who earn $250,000, about 2/3 of those are small businesses. So they report as individuals, but they're actually employing other people. And if we want to find job creation, it's going to be in the small business sector that we have that. So I think that's a real concern. The other issue with taxing high-end plans, you can say, that's great, I don't have a high-end plan, but we know that those costs will be borne by everybody trying to get health insurance. So what that does is just simply raise the cost of health insurance. And if there's one thing I heard in my town meetings, and I've heard from people, it's let's find ways to get the costs down. There are some good ideas to do that. Lawsuit reform, for example, which we've just gotten a score that on the government side would save $54 billion. So you can times that by 2, over $100 billion if you add in private insurance as well. And if we just adopt the sort of reform that Texas and California have adopted, if we adopt that nationwide, none of these 5 bills have any lawsuit reform in them at all. That's a basic area that, if we're looking at healthcare reform, that's one area we need to address. And some people have said to me, well, why is Europe so much less expensive? Why do they spend less on healthcare than we do? Well, they don't have our legal system. They don't have the duplication and defensive medicine that we're practicing here in order to prevent the lawsuits that are so prevalent in the U.S.
I think that's something that a lot of people understand in the abstract but don't understand specifically. I remember talking to a physician from Ardmore, Oklahoma. We had healthcare forums for healthcare professionals in addition to the normal town hall meetings, and this particular doctor said, I don't think most of my patients know that I have to make $150 every day to pay for my health insurance every day for my practice or liability, before I do anything else, before I pay the rent, before I pay the staff. I've got to have that to stay in business. And he said it's an astronomical, and Oklahoma's cheaper than a lot of places in the country.
And if you add not only that malpractice or insurance, but you add the extra tests that are ordered all the way through the medical system that add to the cost of healthcare in America, and they're duplicative, they're not necessary. And we've all had family members where we've seen that happen. That is a real cost, and that's just what they score. And there are some private experts who say we could have savings that even exceed those that were projected by government agencies.
What do you think of the idea, because it's another one you hear, again, we've, I think, mounted a pretty extensive, successful case against the proposal, but again, fairly enough, voters and people at town hall meetings say, okay, what are your ideas? And the ones I always tick off, I usually start with tort reform, as you've suggested, but also talk about national markets and insurance and things like associated health care plans. What kind of impact do you think those two ideas would have on the cost?
Well, I think they'd be significant. We do need to have some insurance reform so that you could join a larger pool, whether that's 2 states joining together in a compact or being able to buy insurance in another state, which you can't do now. That's important. We also need to make sure that we add in the reinsurance and high-risk pools so that those people who have an illness, a pre-existing condition, can get the kind of coverage they need, so they're not denied the ability to get health insurance just because they've been sick. All of those things are things that we could do that I think don't require the kind of $1 trillion, 1,000-page bill that we're seeing developed right now.
There's been a lot of discussion in recent days, and I think my viewers, our viewers, might be a little bit curious about what this is or not, about the so-called doc fix. And could you explain that to them in layman's terms, what this is, how much money would amount to, and how it would be paid for?
Well, this is doctors' payments under Medicare, and there is a formula called SGR, you might have heard it called that, which pays physicians on a basic formula, which, because of the way the budget rules are set, would be reduced significantly next year. So physicians obviously don't want to see a cut in payment. We don't want to see that, because then that means they may be less likely to take Medicare patients. So they had an agreement with the American Medical Association. We'll give you full reimbursement for this on this fee if you don't try to get lawsuit reform in the bill, if you just sort of keep quiet about that. Well, they had a vote in the Senate, and it was not paid for. This is an item that is very expensive to fix in the way they were trying to do it, and that is fix it for all time. It would cost over $250 billion. So I think what you saw is, are we willing to add that again to the deficit, which in my district, clearly jobs are #1 issue, deficit #2, healthcare #3. Do we want to really add $250 billion to the deficit? That, I think, caused a lot of folks in the Senate some real concern. So it did not get enacted, did not pass. So I think now we're looking at a much more short-term, quote, fix for that, where doctors will at least get reimbursed at an adequate level for a year or 2, and then we'll have to address that in the future.
Now, originally in the plans, a lot of the discussion has been, we start collecting fees and taxes 2011. We don't start the plan until 2013-14. I've heard there's some movement on that now. Where are we at? Do you have any idea?
Well, I think there's been some, in the Senate particularly, some desire to bring rather some of the benefits of what they're trying to do forward. I haven't seen that they've been successful with that, but I think clearly they're sensitive to the fact that they're going to raise taxes on people next year under these bills. yet we won't see any policy changes for several years after the next congressional election, certainly after the next presidential election. And so
that
people
might
are
not
going to
be by accident.
people are going to be paying but not getting the perceived benefits. I think what that may mean is they know there's a downside to some of their policy changes, and they want to push that out far enough that if there's a negative, it's not really experienced by people till after at least 2 elections from now. I think that's a mistake. I think what we ought to do is pass bills that are effective immediately so we can get feedback on, are we moving in the right direction? Do we need to make adjustments? There's no reason this has to be done all in one big bill. There's no reason this has to be done in a 1,000-page bill. It can be done broken down, addressing some of these issues, finding the political consensus on those issues, and moving forward.
Speaking of 1,000-page bills, let's go back to one of the most infamous ones. Let me move you to another subject because I could talk healthcare with you the entire show. But let me talk to you a little bit about cap and trade. Again, that's another place where your committee was one of the lead and most important committees. And as you can imagine, a place like Oklahoma, which is an oil and gas state, was wildly unpopular. But unpopular any place where fossil fuel was used in abundance or where there's heavy manufacturing.
Yes.
So they barely passed that, basically an energy tax through the House. I think it was much tougher than they thought. It's over in the Senate now. What's your view of their prospects, and how might the legislation be changing?
Well, I think the real concern with cap and tax, as I call it, is that it would apply to the U.S., but not to 2 of our biggest competitors in the trade world, India or China. And so that you're going to see a vast migration, particularly manufacturing jobs, offshore, as many as 3 million according to the National Association of Manufacturers, because we will have costs added to energy that they don't have in these other countries. And I know with our high unemployment, I've been working really hard to get economic development in our area, and every employer comes in and the first thing they want to know is, what are my energy costs going to be? How are those going to, it's not what are my labor rates going to be? Is there a union here? Not the things you might think that they're asking. It's really, what is the long-term energy cost going to be, and how do I get a consistent supply? So this, I think, is particularly difficult in a time when we're in a recession. We've got high unemployment, to actually raise costs on manufacturing and on energy, which is in everything. It's in the food we buy. It's in the clothes we wear. It's in, it's in our school systems to educate our children. It's a cost in every aspect of American life. I think is a strategy that's failed. That doesn't mean that we can't find ways to explore alternatives. I think particularly natural gas is a real bridge energy to the future, and with the discoveries of the oil shales, there's the Antrim Shale in Michigan. I know around the country there's significant discoveries. That's a very important energy, but we really want an all-of-the-above approach. Make sure that we have nuclear, and obviously wind and solar are pieces, but I have a solar plant that is expanding in my district. And the CEO of that solar plant said, we can't power this solar manufacturing plant with solar power. We need energy to power this plant. So I think that is a real concern. They're just beginning hearings in the Senate. I think it's months away, but we have to keep on top of it. I think it's a very bad strategy for the U.S. It would make us less competitive than we are now, and we know we're competing very strongly with India and China over jobs and job creation. So I think that would be a real bad idea.
Now, ultimately, or initially, there was a lot of discussion when we were in cap and trade about the federal revenue that it might generate. Actually, if you actually looked at the numbers, you could make the argument clearly there was at least some thought that you're going to finance health care reform in part through the revenue that might be generated out of some sort of energy tax. Although quite a bit of that was stripped away during the negotiation in the Energy and Commerce Committee. So do you see this as something that will generate much in the way of revenue?
I don't. And what they did in this bill, I think, is really problematic, in that they gave exemptions, and that, of course, ate up some of their, quote, revenue to various industries, certain sectors, to sort of build this coalition of support behind the bill. And I think if you look at an industry or an entity that's supporting it, there's probably some exception in the bill for them. So I think the lack of even-handedness of this bill is troubling to all of us. But I think the issue I go back to is we don't need to make ourselves less competitive in today's environment. We need to find ways to make ourselves more competitive and develop these other energy sources. And as I said, all of the above, nuclear, alternatives, renewables, natural gas, coal, I think all of those are things that we need to look at. That's COAL.
Hey, whatever gets the name into the show is okay by me. I hadn't really told you I was going to ask you about this, but what are your thoughts in terms of the kind of tax structure that we ought to have? We know that tax policy is an enormous driver in economic decision making by businesses and by individuals, plant location, everything else. So if Dave Camp could be the czar of taxes, I probably should use a different term these days, but
they have enough of those already.
They have enough czars. Yeah, we'll just make you just merely a king.
Yeah.
What do you think are the kinds of tax policies that would, number one, promote the kind of growth we'd like to see in the country, but number two, obviously, you've got to have some revenue to defend the country and build roads and what have you, that would be appropriate for both?
Well, I think the first thing we need to do is reverse the trend that was really made worse in the stimulus bill, where what they did is they are refunding people back more than they pay in taxes. And this isn't just refunding their payroll taxes or other taxes that may have been deducted from their pay. This is over and above any tax liability they may have had. So it's not just income, it's not just payroll, it's over and above that. So they're really turning the IRS into really a check-writing welfare agency by giving people back more than they pay in. I think that is a mistake. Certainly the Earned Income Tax Credit is to reward people at low income levels who are working. That's an income tax refund. This is over and above that. So I think we need to reverse that trend. And in stimulus, it didn't get a whole lot of attention. They increased dramatically by several million people the number of people who get more back than they pay in. I think if you do need the assistance of government, we have a safety net called welfare where there's a work requirement, there's training requirements, there's education requirements, and I think that's the way to go with that, not simply writing checks to people out of the U.S. Treasury in the name of the IRS. But more importantly than that, we need also a pro-growth tax policy. And what I think we need to do is find ways to bring rates down and keep certainty. Right now we're facing a vast array of reductions that are going to expire, whether that's a child tax credit or the marriage penalty or income taxes or death taxes. All of those are going to expire. All of those will go up. I think in a recession, if taxes go up, is a huge mistake. So we need to make sure we preserve that tax relief that Americans have been enjoying that really helped our economy. And then thirdly, I would go with a lower rate, broad-based tax reform that really finds a way to bring rates down both for individuals and small businesses and simplifying our code in a way. It's become much more complex year in and year out. And it's been about 25 years since we had a strong simplification of our tax code, and we need to do that.
That's, I was going to ask you, given the range of things that you're dealing with in Ways and Means right now, and we do have the expiration of the so-called Bush tax cuts at the end of next year, 2010, what kind of time frame do you have to deal with what's in front of you? It's got to be an enormously daunting task, and at least I don't know that much has been done this year. We've been so consumed with administration initiatives.
Well, I think it's one of the other problems. This year it's been all about health care, and some of these other areas really haven't been given the attention and time that they need, and this is one of them. And I think they're counting on that, quote, added revenue that'll come into the government when these go up. But that's just a sort of a scorekeeping measure. If the economy has a wet blanket of higher tax rates thrown over it now, you're not going to see the economy recover, and we know when that does that tax revenues actually go up. Lower taxes usually mean tax revenues go up to the government because there's more activity, there's more investment. Investment taxes go up. I failed to mention those. I think that's a huge problem for us right now when we're trying to find ways to have people hire that extra person, buy that piece of equipment, expand the size of their location, do all of those things that have a positive ripple effect in the economy. And if we don't address those, probably the one that's getting some attention now is the death tax or estate tax. They're looking at locking in current 2009 rates, which is a 45% tax rate of estates at $3 million and above. I think that's where the Democrats are going on this. I think there's still a lot of people holding out for total repeal, but it's more importantly for businesses, for family farmers, for others, they need certainty to plan. Everybody needs a succession plan in terms of death taxes. They need to know what costs they're going to be facing in the coming years, and investment decisions are being made now. or they're not being made as they wait to see what tax policy is going to come out of Washington. And I think that is a real problem that's preventing our economy from growing and taking root again, is that business decisions are just not being made, and that in and of itself is bad, because they're not moving forward on things that will help generate economic activity and ultimately create jobs. And the hardship that's out there now for families is really rough, and what we need to do is make sure that we get this economy moving again. I think that should be priority number one.
We're drawing down toward the close of the program, but I'd be remiss not to ask you really a very specific Michigan question. Michigan is the great epicenter of the American industrial heartland, the center of innovation and manufacturing for over a century, obviously going through a very traumatic and challenging time, highest unemployment rate in the country right now. What do you think the outlook is, and what are the things we ought to be doing nationally to help bring back what really is the cornerstone of American prosperity, and that's manufacturing in places like the Michigans and Ohios and Indianas of this country?
Well, I think that we've got to make sure that we don't let our taxes go up. And I think that's a decision that we're going to have to make in the next couple of months. I think we also need an emphasis on, preserving and keeping manufacturing here in the U.S. And that means not adopting policies that make us less competitive, like an energy tax. I would support also even a trade enforcement prosecutor, somebody whose job it is to wake up every day and make sure our trade agreements are being complied with. It's clearly important in this international global economy that we trade with other countries. Every successful society has, from the beginning of time, has found ways to trade with others, and so we need to make sure that those agreements are followed. But that doesn't mean that we shouldn't continue to find new markets, and I think this administration has been really silent on the issue of looking for new markets. Certainly the farmers I represent understand the importance of finding new markets. We need to continue to do that. What we're seeing is other countries are outflanking us on that while we just sit here and do nothing. And with countries like Colombia, where they have access to our markets without tariffs, and all we're doing is giving our goods and services access to their markets, it seems we should move forward on items like that.
Give me 30 seconds on the stimulus.
Well, the stimulus, as you know, didn't create the jobs it was projected to create. In fact, we just had a report from the Council on Economic Advisors. Christina Romer, the chair of that, said whatever bang we're going to see out of the stimulus, we've already seen, which we haven't seen any. Every state but North Dakota has lost jobs under the stimulus. They promised if this was passed immediately, which no Republican in the House voted for, that we'd see incredible job creation. Not only have we not seen that job creation, we've seen job loss greater than if we did nothing at all. So I would repeal the stimulus. There's about $200 billion that's unobligated, and I would repeal that in a heartbeat.
Well, Congressman, we're already past our time limit, or just about to close out. I want to thank you, Dave, very much for taking the time to come, and I think clearly our viewers and listeners will understand why you're held in such enormous respect in the Congress of the United States, really on both sides of the aisle. You really are one of the more thoughtful and, frankly, well-versed members on policy. And I think the more people see of people like you, actually the better they would think of Congress.
Well, thank you, Tom, and thank you for your leadership here. You're one of the people that I go to for advice, and thank you for letting me be on your show.
Oh, it was an honor to have you here.
Thanks
very much.